Here's the problem. According to a Harvard University study, each year more than 1.5 million American households must borrow money from their home equity and their retirement savings to pay for expenses related to a critical illness, like cancer, that are not covered by their health insurance. In fact, 700,000 families and individuals of all ages are actually forced into bankruptcy by these debts. For example, according to the American Cancer Society, 3,000 people are diagnosed with cancer every day. But as much as 60% of cancer-related expenses are typically not covered by ordinary health insurance, including many new therapies and experimental treatments or medical procedures, as well as fees for specialists or clinics that are not within the approved network. What's more, health insurance does not cover extended convalescence and home nursing care or assistance with housekeeping, cooking, cleaning, and child care, or the loss of earned income while the patient recuperates from surgery and struggles through chemotherapy or radiation treatments. But all these expenses can cost thousands of dollars over months or even years of treatment and recovery. So what's the solution? $50,000, $100,000, $200,000 or more paid directly to you tax-free, in addition to your health insurance coverage, and usually within 20 to 30 days of reporting a doctor's diagnosis that you have any one of several major medical conditions, like cancer, heart disease, stroke, kidney failure, blindness, paralysis, even Alzheimer's or Parkinson's. The solution is critical illness insurance, supplemental coverage for expenses not covered under your health insurance. And here's how it works. The money you receive from critical illness insurance is in addition to any other coverage you have or other benefits you might receive, and this money can be spent however you choose, to pay for medical expenses or non-medical expenses, even if those expenses are not directly related to your illness. For example, if you cannot work during your illness, you can use the money to pay your bills, or pay off your home mortgage, your car loans, or your credit cards. Critical illness coverage gives you options that you don't have under your health insurance, options that can improve the quality of care available to you, because critical illness coverage enables you to pay for alternative therapies and in-home nursing or convalescent care that are not covered by your insurance, or doctors and clinics that are not in your insurance network. And critical illness insurance can prevent you from using up your savings, going into debt, or forcing you into bankruptcy. It can protect your home equity and your retirement accounts too. It can also keep you from needing to ask family or friends for financial assistance. Just ask anyone you know who has personally suffered through a critical illness like cancer. Ask them how much of it was not covered by their health insurance, and what a difference an additional $100,000 would have meant to them. For example, Larry and Ann were in their mid-40s with 2 teenage daughters when Ann was diagnosed with breast cancer in 2004. They both had good health insurance through their employers, but they also had $100,000 of critical illness coverage, which they used to pay for expenses that were not covered under their company health plans because Ann survived her breast cancer. But she was out of work for more than a year, and after she used up all her sick days and her vacation time, her disability benefits paid less than 40% of her salary. What's more, in addition to losing 60% of her income, they also had $42,000 of other expenses that were not covered by their health insurance. So, if they didn't have critical illness coverage, they would have been forced to withdraw the money from their retirement savings, which would have reduced their retirement income by almost 40%. So ask yourself this: with cancer striking 1 out of every 3 people, does it make sense to risk your financial security, your home and your savings, even your retirement, to pay for expenses that are not covered by your health insurance? Or does it make better sense to add critical illness coverage to your current health insurance and prevent the need to use up your savings or borrow money from your home equity and your retirement accounts?